Okay, so for the substance abuse, like I said last time, I distinguish it between two types: central nervous system depressants versus central nervous system, stimulant. But I don't like memorizing the symptoms too much, but I will give you one with the symptoms, one without symptoms, and you can pick which one you want. Okay, for the central nervous depressant, we have anything that can depress nervous system. Basically, you bring it down, like barbiturates, phenobarbital, and then alcohol. These are the group of drugs that would decrease your nervous system. They bring it down. Then there's those central nervous stimulants, and they are usually anything that may ramp up your central nervous system, like cocaine. When you take cocaine, or amphetamines, or methamphetamines. Okay, so these are the group. I separate the opioid from each other. They are also central nervous system depressant. They depress your immune and the central nervous system, but I separate them because they act different a little bit. So I put them away, but they still central nervous system depressant. Okay, so this is where we have. Okay, so you can group them, and then when they ask you a question, and then you can give them the answers. I'll put it here. Okay, so these are the first group. Okay, for the stimulants, let's do the depressant first. They will decrease everything down. So the thing you have to worry about is this intoxication. This is what confuses people. Versus, withdrawal. When you take the medication, you are intoxicated with it. So intoxication, that means you have a lot took in the drug. So if I took in these drugs, and because they are central nervous system depressant, it's going to decrease my central nervous system, all the stuff. But specifically, there is specific symptoms with that. So if you want to memorize this one, this is what they are. All central nervous system depressant, they will cause a slurred speech. Okay, they will make you drowsiness. Okay, and they will impair your judgment. So like when you get drunk, you can't make sense, right? Your reflexes will go down. It's like +1. Okay, your gait will be unsteady. Okay, so this is what they do. If you take in too much, that's what is going to happen to you. So this is when you have intoxication of that, things are going down. Okay, and then when you withdraw, that means you don't have it. The best way to think it, if I take in, you depress me down. If I don't have it, then it will wrap me up. I need to get more. Your body telling me I need more. So we'll be acting out. That's the way to remember. I have to go up and get them. So my symptoms have to ramp up. So when you are withdrawing from these depressants, your symptoms, all of them will be going up. But specifically for these people, the depressant, they will have like nausea. For all like the benzos, the alcohol and the barbiturate. They have nausea, they will vomit. Okay, and what will happen? Their heart rate goes up. They will be sweating. They will be sweating, right? They will have tremor, and then they will have seizure. This is specific for that. Okay, they will be restless and irritable. So this is specific when somebody who is taking alcohol, has not had alcohol for a couple of days, you expect them to be acting like that. If they drink the alcohol, yeah, intoxication, they will be like that. If they are not, and after 48 hours, they don't have those medications, this is what they will have. Okay, this is what they will have. Things will start going up. Okay, so that's the classic for central nervous system depressant. For the opiate, the reason why I separate them, they also have specific symptoms. If you take in opiate, you have specific. So examples like heroin, okay, when they give you something like that, or these are all opiate, or like oxycodone or hydrocodone or codeine. These are all opiate, right? When you take in those medications, specifically because they are depressant, yeah, heart rate goes down, respiratory goes down, blood pressure all goes down. So these are specific for them. And you have to look at their people. Their people become constricted. Okay. This is specific for opiate. Okay, their people will be constricted. They will be lethargic. And their reflexes, like I said, also goes down. But the people you should not forget, in answer choice, look for that. That's classic for opiate. If they withdraw from that, okay, if they withdraw, that means after a couple of days, they don't have it. Yeah, because they are depressant, now they're going to go what? Up. They will start going up. Signs and symptoms will be up. Yawning is going up. They're looking for more. They're yawning specifically. That's what happened. If you watch them before and you go to the areas where they do this, you see them yawning, scratching their self, like they keep on, they can't stay still. You know, they will be having like panic attack. Something's about to happen. They know something's about. They feel like they're about to die. You know, they will be sweaty and they will have cramps everywhere. Okay, they will have nausea and vomiting. Okay, the same thing: nausea, vomiting, diarrhea. Okay, and these are all signs and symptoms that will. So this is specific for opiate. And you can see what will happen to their people. It will be dilated instead of being constricted. So a dilated pupil for that particular for the opiates. So if they give you a question, look if there is a specific signs and symptoms that is classic to that. Opiate like that, look for the people. I would separate the alcohol to alcohol is a little bit notorious. You get hallucinations specifically for that. And so this is the down. These are the depressant basically. Okay, Babi treats it. For the stimulants, think about it. Things actually go up because they stimulate you. So they stimulate you. So if you take in intoxication, yeah, your symptoms will go up, right? Your symptoms will start, the heart rate goes up, right? The blood pressure goes up, really high blood pressure. Their pupil will be dilated. So dilated pupil. That is different from opiate. If I take an opiate, my pupil will be constricted. If I take cocaine, my pupil will be dilated because you got to go up. And so when they give you a question, this is how you can do the differential diagnosis to figure out this thing. They will be paranoid. These people, they feel like they're on top of the world, okay? They will have paranoid and delusion specifically for that, okay? And they have diarrhea and their reflexes go up, okay? So like +3. If they intoxicated, guess what? And withdrawal, things will start going down. So withdrawal, so this is withdrawal. Okay, so if they withdraw, things will start going down. And what do you think? They will be depressed. And you've seen cocaine person, yeah, they will be like depressed. They will be craving for it, and so they just like can't take it. and they will be tired. The appetite may go up. Okay. And these are the specific for that. And that's the way you, if you want symptoms, this is the way you have to remember specifically for each of them. If you don't want to remember the symptoms, then you have central nervous system stimulant. You just have to remember the names of the drugs that are in cocaine. I forget a bunch of them, but LSD, there's a PCP. There's some people, some they call it highs, yellow highs. Sometimes they have so many names, and these, when they take it, they're very, very violent. They'll present like that. They're on top of the world. Amphetamines, okay, and methamphetamines. You've seen them, and if you watch Cops, I used to watch Cops all the time. And you see them, they're on top of the world. So you see that. So this is what you see. These are the drugs that are under it. What is the problem? If they intoxicate and they tell you this patient is on it, look for symptoms that are all up. They give you the list of symptoms, and you look at it. So the sound going up. If tachycardia, blood pressure goes up, all these things, diarrhea, nausea, something is going up. And you look at the symptoms and look at it carefully. If it's going up, yeah, you pick it. Right? And if they withdraw, right, the symptoms all go down. That's all. So you're looking for downgoing symptoms, especially in the select or apply questions, or if the case, you look at the case and it's a patient took this in, it's been 4 days, he has to be withdrawal, and then you have to be looking for downgoing and symptoms for these people. That's all. And then for the depressant, central nervous system depressant, if they take in, so intoxication, where you should be looking for downgoing symptoms. And then when they withdraw, you're looking for upgoing. So if I give you opiate, okay, and I tell you somebody took opiate, okay, he took in probably hydrocodone 2 days ago, he uses it every day, okay, and it's been 5 days, he doesn't have it, that means he's withdrawing now. So you should be seeing symptoms that is going up. Like, that's what you should expect. He should not be constipated. His people should not be constricted. It will be dilated. It will be craving. It will be like yawning, looking for more. So whatever signs and symptoms that look for more of that problem, yeah, that's what you're picking. Okay. Now, alcohol is notorious. Okay, it's just like not that. So alcohol is a downer. So it goes down. So when it's a depressant, that means when you take in, symptoms goes down. That's why you have a slur speech. You can have a good judgment and all those things. Just know that when they withdraw, their symptoms goes up. So if they say somebody who is alcoholic, he drinks 5 beers every day, and he's been admitted to the hospital for 48 hours, you should be worried that this patient is going to go into withdrawal. So you'll be looking for upgoing symptoms. But the most important symptoms is hallucination. For these people, they will be having all kind of hallucination except auditory hallucination. So they will have all the sensation, tactile, okay, visual, okay. They will be like they're seeing things on the wall, something is crawling in their skin, the heart rate going up. All these things is consistent, but look for hallucination. It's classic for alcohol withdrawal symptoms. And so because of that, you have to prepare. Prepare for this. So in the question, prepare for what? Delirium tremor, okay? That is DT, that's deadly. This is a deadly problem. And you occur at 72 hours. So you want to like get them before they get there. So when they come in, what do you give them? You give them banana bag, which is an IV fluid with a bunch of vitamins. What do you think vitamins they get? They get vitamin B1 because they have thiamine deficiency. They don't eat. Okay, they're more nourished. Their magnesium is low. Okay, so they all these things need to be put in the so they have vitamin B1. So this is B1. So thiamine deficiency. Okay, so you put them on this, you give them IV fluid, and you have to provide a seizure prophylaxis. So they get a benzos, whatever you want to choose. Okay, and you think about it, you give them another central nervous system depressant to depress the central nervous system. That's why we give them benzos. If you're going to have a seizure is a form of excitable central nervous system. So I'm going to give you something to depress your central nervous system. You give them benzos, okay? You cannot give them phenytoin. You take forever, okay? You can't do that. You got, if they put carbamazepine, you can't choose that. If you're preventing seizure prophylaxis, give them something that is shock acting that will act right away. So they get a lorazepam, okay? The Valium, I forget the other name, but they get any of the PAMs, okay? Those are medications to lower their immune system, the nervous system, to depress it. So any of the benzos, they're going to take in to help with that. And that's the seizure prophylaxis. You don't give them glucose. So this is another thing. Don't give them glucose before you give them thiamine. Otherwise, they go into Wernicke encephalopathy because of the thiamine deficiency. If they give you a question like that, it's Wernicke. We saw that, like where they can get problem with their thinking, okay, and then Wernicke costs off. Okay, so you have to give them thiamine because thiamine is used to break down glucose metabolism. If you give them glucose, they will get encephalopathy, confused, delirium, because you give them the opposite way. So thiamine, glucose to avoid Wernicke, cause-off, encephalopathy. They will be confused. They will be restless. They will be like go into seizures, all of them. Okay, remember that. Then something about alcohol. This one, I like to say something about it. Disulfiram. If they come in and we got to send them home, they go to a rehab and they drink, we put them on this. People get confused. This is, I call it anti-abuse. So I call it anti-abuse medication. It's used to prevent you from taking alcohol. It's alcohol aversion medication. You should not drink alcohol with that. It's deadly, okay? They will give them bad reaction. They can die from it. So you have to tell them about disulfiram, basically to prevent you from drinking alcohol. That is what it is, alcohol aversion. But people don't know what to do. They think if I don't go to the corner store and get my 6 packs, then I'm good. Guess what? That is wrong, okay? When you go to the bathroom and you start shaving yourself, most of the shave for male, there's alcohol in it, okay? You put on a perfumes, yes, you have alcohol in it, okay? And some of the over-the-counter medication for cold medication has some alcohol in it. So you got to read the label like your head is not there. You have to be looking for any source of alcohol. Hand sanitizers, you can use it. So you can't use any of them, okay? If you use it, then we have a problem, because the alcohol get absorbed, and it's the same thing like you drinking alcohol. So those are the things you tell the patient, hey, I know I told you not to drink alcohol, but there's certain things that has alcohol in it. When you shave, don't use those after mouthwash. Mouthwash and everything. And all those things have alcohol in it. So you should avoid that, So mouthwash is one of them. Okay, you can't take it in. So there's other things that have alcohol in it that you should not use. So yeah, mouthwash also have alcohol in it. Even your colognes, and I think it's the same as perfumes as alcohol in it. So just be careful. So this is the briefly, that's why I separated a little bit. And lastly, if I'm the mother, I'm the father though, I'm the mother, I give birth to a baby, and I used cocaine, I used some drugs, okay, whatever drug it is. I use some drug. I'm the user. So I use drugs during pregnancy. This is key, 24 hours versus within 24 hours versus after 24 hours. Always, 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 always. How many always I would say? Always, maybe one more. Always assume that as soon as they're born, within 24 hours is intoxication. The kid is intoxicated. So if they give you a question and they said the mommy used some drug, the kid is born 5 hours ago, expect signs and symptoms of what? Intoxicated. If they use a downer, okay, then expect their symptoms to be depressant. If the mommy use a what? APA, the kid symptoms should be what? APA. That's all. The first 24 hours. If it's greater than 24 hours, so 2 days later, yeah, expect a what? A withdrawal symptoms. This is the key so that you don't mix the question. They won't tell you what kind of symptoms you should expect, but they'll say, mommy use it, it's been 24 hours, it's been 48 hours. What do you expect when you examine the newborn? Yeah. If it's a downer, now they will be withdrawing from it. But within 24 hours, they are still intoxicated with the drug. So they will see signs and symptoms of intoxication. Yeah, take folic acid with alcohol. Yeah, that's good. All the vitamins. So that is all on substance abuse.